All right, the man accused of shooting and killing at least 18 people in Maine was reportedly admitted to a mental health hospital for 2 weeks in July after acting erratically during training at West Point with his Army unit. According to a police bulletin, Robert Card was hearing voices and threatened to shoot up the military base. So, are the voices what drove him to kill? And if so, what could have been done to prevent it from happening? Joining us now is Dr. Daniel Bober. He is the psychiatrist and chief medical officer of Odyssey Behavioral Health Care. What does that indicate to you if you're hearing voices and threatening to shoot up members of your own unit?
Hearing voices are symptoms of psychosis, which literally means a departure from reality. Psychosis can be caused by a number of factors: substance use, someone being in crisis, which can increase their cortisol, sleep deprivation, and sometimes schizophrenia, although he's 40 years old, so this would be a little bit old for someone to come down with schizophrenia. Usually we see it in the late teens and early 20s.
There are reports out there that are unconfirmed, so we don't know if they're true, but there are reports out there that he was prescribed medication and that he stopped taking it. You can't force somebody to take medication for a mental health condition.
It depends. If they're an imminent risk of harm to other people or themselves, you can. This might just be someone.
Doesn't it sound like he was, though?
It does. It sounds like some things slipped through the cracks here and they should have been addressed. But normally someone who's a danger to others or themselves can be forced to have medication. Usually it requires the opinion of a second psychiatrist and a court hearing, but it can be done.
He was admitted to a mental health hospital for 2 weeks. That time period is pretty crucial here because anything longer than 2 weeks, does something else fall into play, or is that a standard amount of time to stay at a mental hospital?
2 weeks would not be a standard amount of time. We're talking about usually a 72-hour hold, where at that point, once the 72 hours expires, the psychiatrist would need to petition the court to hold the person longer. So I'm curious what happened. What was the follow-up plan when he left the hospital? Was he given what we call a long-acting injectable form of the medication? Because very often people will stop the oral medication, but if you can give them a monthly injection, it will stay in their system for a month. So I would want to know what they did for follow-up and if he fell through the cracks.
Right. And we know that Maine has something called yellow flag laws. First of all, Maine has a very high percentage of gun ownership. 46% of Mainers own guns. It's a big hunting community. It's also got one of the lowest crime rates in the nation. So we're not saying anything here. But the yellow flag law is supposed to empower people, police, courts, to take away temporarily firearms from people who are a danger to themselves or others. If this man was hospitalized in a mental health hospital after threatening to shoot at members of his own unit, doesn't that qualify as a danger to himself or others, and shouldn't a yellow flag law have been triggered?
I would say so. Something is amiss here for sure. But it should be noted that only 4% of interpersonal violence is directly attributable to mental illness. People with mental illness are more likely to be the victims of violence and not the perpetrators. But in this particular isolated case, it seems like he was having mental health symptoms which can be associated with violence, specifically paranoia. Auditory hallucinations, especially if they were command in nature, would raise the risk of violence.
How often do you see somebody like that threatening to shoot up other people? Does that happen very often?
I actually see it surprisingly quite often, probably
Really?
once a month. Yes, absolutely.
Wow.
And I actually fill out forms that require the guns to be taken away from those people. This is something I do on a monthly basis.
Wow. Okay. Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.